Hello everyone, I am Dr. Prabagar. I am the Professor and HOD, Department of Medical Oncology, Coimbatore Medical College Hospital, Coimbatore. Today, I am making this video to create awareness about head and neck cancer, that is cancer of oral cavity and throat. So, what is the cause of head and neck cancer? So, we all know the answer. It is the tobacco. So, tobacco consumed in any form, smoke form, smokeless form, is injurious to health, and it is the main number one cause for the head and neck cancer. Tobacco smoking either as a BD, a cigarette, or a cigar, or all are bad. Someone can say, I am not a smoker, but I consume tobacco in other forms like chewing with pan masala, as a pan parag, or as gutka. So am I safe? No. Tobacco in chewing form also is equally bad to cause cancer. And tobacco is the commonest cause. That is 80 to 90% head and neck cancers are due to tobacco only. The other causes include alcohol consumption. If you consume alcohol along with the smoke, the chances of getting head and neck cancer increases very much. Apart from these two causes, poor oral hygiene, infections with the human papilloma virus, and sharp tooth which injures your tongue and inner side of the cheek frequently may also give rise to oral cancers as well as throat cancers. So what are the symptoms of the head and neck cancers? So you may notice an ulcer on your lip or inner side of your cheek or on the tongue or on the floor of your mouth or roof of your mouth or in your throat. So which is not healed by regular treatment for more than a month or so. It could be a malignancy. The second, it can present as a growth. It may present as a growth which is not healed by regular treatment in the above set areas. The other symptoms are there may be difficulty in swallowing, or there may be change in voice, or there may it also present as swelling on both sides of the neck. This also may be a cause for reason for symptom of head and neck cancer. So if there is any symptoms, what we have to do? So does all the ulcers or growth or cancers? Most of these ulcers or growth or may not be cancers, but minority of them can be cancer. So how will you know whether it is a cancer or a normal growth? For that, we have to do a biopsy. That is, a bit of the ulcer or the tumor has to be removed and examined under microscope to see whether it is a malignancy or a non-cancerous ulcer or growth. There is one big myth going in our society. That is, if you do biopsy, a cancer will spread. This is an absolute false notion we all consume. Because whether you do biopsy or you don't do biopsy, a cancer growth will grow and it will destroy the entire organ or entire structure. So by doing biopsy alone, it doesn't mean it will spread. Even without biopsy, it will spread. So biopsy is the only test to confirm the presence of cancer. So after confirming by biopsy, then we have to stage the disease. At what stage? Stage 1, 2, 3 or 4. For that, we have to take a scan of the head and neck region. We can take many scans are now available like CT scan, MRI scan. Now latest PET scan is available, and with that scan we can see what is the extent of the disease, what are the structures involved, whether the adjacent it has spread to the adjacent lymph nodes or not, whether it has spread to the other organs like lung, bone, which all can be made out with a scan. So after diagnosing, after staging, we have to plan a treatment. The treatment is very simple if you diagnose at early stage. Stage 1 disease, the treatment is very simple. It's going to be a simple surgery. Will remove the affected part. If at an early stage, that alone will be enough. Or if surgery is not possible, they will treat it with radiotherapy alone. So with a simple treatment, we can cure completely if we are diagnosing the cancer at an early stage. But if if we diagnose the cancer at an advanced stage, then the treatment become complicated. You may have to do surgery, then after the surgery, you may have to give radiotherapy also and chemotherapy also. So if surgery is not possible, we have to give chemotherapy, reduce the size of the tumor, then do surgery, then after that we may have to give radiotherapy and chemotherapy. So it will become a cumbersome process. Not only that, the chances of cure also reduced to around 60 to 70%. A complete cure which can be achieved in an early stage will be reduced to 60% if it is an advanced stage. Can we prevent this dreaded disease? Of course, we can prevent this disease. So all we have to do is we have to stop consuming tobacco and we have to stop consuming alcohol. With that, we can reduce about 60 to 70% of occurrence of this head and neck cancer. Apart from that, we have to live a healthy lifestyle. We have to maintain a balanced, nutritious diet. And apart from that, we have to consult an ENT surgeon or a dentist once in 6 months or at least once in a year to look for any hidden diseases. The doctors will find out anything abnormal. If it is needed, then they may intervene. And if there is any symptoms which is suggestive of malignancy, which I have told you already, like any ulcer or growth or lymph node swelling, then immediately we have to seek a doctor's attention. We should not be afraid, fearing malignancy, but you have to seek a doctor's advice and to diagnose and to find out early so that treatment can be complete and completely curable also. So I like to say that whoever watching this video to know that the head and neck cancer is completely preventable and it is completely curable if it is diagnosed at an early stage. And I also want you to spread this message to your relatives, friends and known persons and unknown persons so that you can play an important role to our country in reducing this dreaded disease burden so that our country's health status will improve. Thank you.